Okay. Let me ask you a couple questions from the perspective of a person who thinks that maybe they're experiencing some of the early signs of Alzheimer's disease. Where should they turn for evaluation and treatment?
Again, as I mentioned before, no one should diagnose him or herself, partly because there are other conditions that can cause the same symptoms, and also because we do know that as people age, their ability to recall or remember words, facts, names does decline a little bit. Now, it's a small amount, it's about 5%. But it's noticeable, and so just because you've noticed a change in your memory doesn't mean it's serious. The difference between that 5% change and the dramatic loss of memory that we see in Alzheimer's disease is usually pretty clear to a clinician. So we can distinguish between normal changes and the disease changes. So I think the first thing people should do is see their primary care doctor, raise this as a concern, and be evaluated.
Well, let's say that after a good, thorough evaluation, they do realize that most likely, very good chance, it is Alzheimer's disease. What are some things they should do to prepare for what lies ahead? And I'm thinking here not just medically, but also financially and legally.
Yeah. Well, people do ask, why make the diagnosis? And I think your question, therefore, is a good one. Because at the beginning of the illness, there are many things people should and can do. Some people haven't written a will, and of course they should do that to indicate where they'd like their possessions to go, were they to die. But many people haven't written advance directives or had a conversation with a loved one that if they became incapacitated, what would they like to happen? And so getting a diagnosis early offers a person sometimes the impetus to think who would they like to make decisions for them, to sit down with that person, to talk about their values, their wishes. And that doesn't have to happen in one visit or in a week. You can have that, if you find this early, you can have that meaningful discussion over weeks or maybe even months. I think that it gives people time to get their financial affairs organized in a way. And again, I think to be able to talk with people about your preferences, how you like to live the rest of your life, is not only important for the person who's making that decision, but most family members really welcome that kind of guidance. And unfortunately, this is a disease that ultimately robs most people of their capacity to make decisions for themselves.
Well, let me pick up on that, and let me ask a couple questions then from the perspective of the family members. What are some of the challenges they will face? Let's take you mentioned sort of 3 stages here. In the first stage, early stage of Alzheimer's disease, what are some of the challenges they'll face, some of the decisions they might have to prepare for, and where do you suggest they turn for help on these matters?
Well, one of the challenges at the beginning of the illness is that for reasons we don't fully understand, people with Alzheimer's disease often do not know that they have a problem. In fact, probably only about 1/3 of people really recognize that something's wrong. So often the family has noticed something has changed, is different, isn't right, but convincing the person to go to the doctor to get evaluated can be a challenge. So that's often the challenge in the first stage. And what I recommend sometimes to people is that if that problem comes up, to ask the person if they would get evaluated for your sake. Maybe nothing is wrong, and you would then be reassured. But if something's wrong, you'd also feel a lot better knowing that the doctor was involved. And then getting people to think about advance directives and wills. If they haven't done it already, sometimes that's a challenge. In the middle stage, people usually start to develop real impairments in everyday living, start to have trouble doing the checkbook, losing the ability to find their way around in a car, to concentrate. And so getting people, for example, to give up their driving privileges, that can be a real challenge. Someone who's hunted his whole life, to get him to appreciate the fact that it's probably dangerous because the symptoms of the disease impair the ability to see, impair judgment. Those can be real challenges. And to sometimes get people in the middle stage to understand and accept the fact that they need some help and support for things they've always done. And you could imagine if someone told you you needed help getting dressed, you'd probably bristle at that. I mean, that would make you feel like an infant. And so it is often hard to convince the ill person in this middle stage that they need help with those everyday kinds of things. In the third stage, many of the challenges relate to physical problems. Incontinence care, people start to fall, people may start to have swallowing problems, and so they're not able to maintain enough caloric intake. So there are a lot of challenging decisions around long-term care placement, toward the end of the illness, sometimes about placing feeding tubes. So there are challenges all through the illness, and they do change somewhat with time.
Does there generally come a time when the family needs to seriously consider placement in a facility?
Yeah. In this country, probably 90 or 95% of people with Alzheimer's disease ultimately need and require long-term care placement. This wasn't true 50 or 100 years ago because people didn't live 8 or 9 or 10 or 15 years with Alzheimer's disease. They would get pneumonia and die. But we have good medical treatments now for diabetes and pneumonia and many of the other serious illnesses. So people live much longer with the illness than they used to. And when people become physically debilitated, they very often need long-term care. However, what research has taught us is there is no one trigger for long-term care placement. It really seems to be different for different families and for different individuals. And that's partly, I think, because the disease has a number of different manifestations. The single best predictor of needing nursing home care actually is the development of a severe behavioral or psychiatric symptom. So that's one of the reasons that people need to be placed, because the family just can't manage a person with those symptoms. But after that, there's this myriad of physical problems that people need help with. And again, often their spouse is also quite aged and perhaps frail. And so the spouse can't provide that care, even though he or she would feel obligated to do it. And helping people accept that good nursing home care is a necessary part of our health system and something we should demand because it helps people with this kind of illness. That's the direction I think we should be moving in.